is the inherent unfairness of drug prohibition. Then we'll talk a little bit about what sorts of drug law reform we might anticipate happening in the next decades, when this is going to happen, how it's going to happen, and a few other bits and pieces. Before we get into the talk, I do want to emphasize that it really is very, very appropriate that this group of skeptics, above all else, is dealing with this subject, because if any subject is really about the tension, the debate between evidence-based approaches and intuitive-based approaches, it's this subject. So why do we say that, why do many people say these days that drug prohibition has failed comprehensively and abjectly? Well, for a start, the drug market has expanded inexorably in the last half century, during which the world has been wedded to the idea of drug prohibition. Production has been up, consumption is increasing spectacularly in many parts of the world. The price of drugs like heroin and cocaine has fallen by over 80% in the last quarter century. Drugs are often more pure today than they were years ago. And drugs like heroin, cocaine, amphetamines, cannabis, 80–90% of drug users say that in Australia say that these are very available or available, readily available. So these are all some of the problems. We've got increasing numbers of new drugs becoming available, coming onto the drug market, and very often these are more dangerous than the drugs that they're replacing. Now, all this is discussed in an article I published in August this year in the Australian New Zealand Journal of Criminology, and if you want the data, it's all in that piece. But even more worrying than the fact that the market has expanded, drug prohibition is meant to keep us healthy and safe, and it hasn't been doing that. The outcomes have been terrible and have been getting worse. The rate of heroin overdose deaths in Australia increased 55 times between 1964 and 1997. 55 times. And I say rate because that means it's adjusted for the increase in Australia's population. And drug prohibition was really lead in the saddlebag when we were trying to control HIV and hepatitis C and hepatitis B and many other infections that are related and problems that are related to illicit drugs. We talk a lot about the increase in property crimes associated with the increase in the drug market, but there's also been an increase in violent crimes. Just remember that 38 methamphetamine traffickers in Melbourne who were executed by other criminals in the period 1998 to 2010 that was celebrated in that television series Underbelly. So it's not just property crime, it's also violent crime. And corruption is a very significant problem here in New South Wales. The second most senior person in the New South Wales Crime Commission is serving a 22-year sentence for his involvement in a $130 million drug trafficking ring, methamphetamine drug trafficking ring. Lots of other corruption as well that's linked to the ineffective attempts to enforce the drug laws. And mass violence we're seeing now in many parts of the world, including Mexico. December 1st, 2006, the incoming president of Mexico, Felipe Calderon, declares a war on drugs on his first day in office. By the time he leaves office, 6 years later, somewhere between 60 and 70,000 Mexicans have been killed, have been murdered by drug traffickers, the army, or police in Mexico in the failed war on drugs. It hasn't made drugs less available. And last year, 23,000 Mexicans were murdered as part of this cycle of violence that has now been tripped into by the war on drugs declared by President Calderon in 2006. So it's a very serious situation now. We've got those 43 students who disappeared a couple of months ago. And there are serious threats to national security. Why did Australia send troops to Afghanistan after 2001? Well, part of the reason was because of the huge drug trade that goes on in Afghanistan, feeding demand, which in turn has been whipped up by the lucrative profits that are involved in the war on drugs. So Mexico, Afghanistan, Pakistan, a number of other countries around the world are serious threats to national security of faraway nations like the United States and Australia. It's a big problem. Now, these days we're starting to see world leaders, not referring necessarily to Mr. Rabbit in that epithet, but we're seeing world leaders starting to walk away from the war on drugs approach. And here's Tony Abbott on the 29th of April 2014 on an interview on 3AW radio in Melbourne saying the war on drugs is not a war we will ever finally win. The war on drugs is a war you can lose. You may not ever win it, but you've got to fight it. Now, I don't understand why, if you can't win and you may lose, why you've got to keep on fighting it. I would have thought what you should be doing is going back to the drawing board and having to think about maybe drug law reform. Tony Negus, who was then the Commissioner of the Australian Federal Police, on the same day said, this isn't a problem law enforcement can arrest its way out of. So we have now seen a shift in Australia. No previous Prime Minister, no previous leader of the opposition had ever acknowledged the futility of the war on drugs. One side of this debate that is really not touched upon is the inherent unfairness and injustice in fighting the war on drugs and in trying to enforce drug prohibition. Now, we've had a debate in recent years, it lasts really since 2001, especially about the inherent unfairness of imposing criminal sanctions on people who want to have same-sex sex. And many, including a lot of young people, now see that imposing criminal sanctions on such people is inherently barbaric. But if we accept that there's something wrong, something inappropriate about people with majority sexual preferences, imposing punishment on people with minority sexual preferences, well, why doesn't the same principle operate for drugs? Why isn't it also barbaric for people in the majority with majority preferences in drugs to punish people with minority preferences in drugs? Vicarious punishment is the idea that you punish one group of people who are innocent in order to deter some other people from doing a behaviour you don't want. And it's universally recognised that this is a wrong thing to do. And the most famous example of this, some of you may know about, is the destruction of the town of Lidice and the murder of the inhabitants of that town in what is now the Czech Republic after the assassination of the Nazi leader, Heydrich, in the Second World War. And this is exactly what we do with illicit drugs. We punish one group of people to deter another group of people from using those drugs. Another argument that is made about to justify drug use is that it's in the benefit of drug users to be punished, to deter them from using drugs. But we don't apply the principle of proportionality here, a very fundamental principle in the rule of law. There are no criminal sanctions for people who go mountaineering or sail solo yachts or go hang gliding or smoke cigarettes. Why don't people who smoke cigarettes get a 2-year sentence or a 5-year sentence in jail to deter them from this dangerous habit which kills 50% of people who have that behaviour? These are powerful arguments, but I believe, they have very little traction in the community. You don't often hear them. It's an excellent book written on this subject for those of you who want to take this further, written by Douglas Hussack. Terrible title, wonderful book. It's called Legalise This, The Case for Decriminalising Drugs. And he goes into that in great detail. Okay, a few principles that we should really discuss before we get into the nitty-gritty. This whole exercise is about trying to fit square pegs into round holes. And we have three kind of principles that we're trying to follow. One is that we are trying to carry on our commitment to the international drug treaties that Australia and about 185 countries around the world have signed. And these are the 1961, 1971 and 1988 international drug treaties. Almost every country in the world has signed up to these treaties. Another problem is we've got to somehow reconcile those treaties with the inexorable laws of economics, the law of supply and demand, that if there is strong demand for something, there'll be a supply coming from somewhere, and if no legal supply is available, then other sources will emerge. And the third part of this is the unmovable mountain of politics. Well, it's been unmovable up till now, and here the problem has been that bad policy has for such a long time been good politics. And that's now starting to change a little bit, which is why Mr. Abbott made that comment on the 29th of April. One of the things that's rarely discussed in this issue is that under Prohibition, more dangerous drugs displace less dangerous drugs. And Joe Westermeyer wrote about this in 1976 in this article in the Archives of General Psychiatry. And he looked at 3 countries in Asia which banned opium smoking, terrible practice, largely carried out by old men in Asia in those days, made them very constipated. They used a lot of the slender resources of family to smoke opium. Really reprehensible, terrible. So it was banned. What happened was that that practice of opium smoking was replaced by heroin injecting, this time in young and sexually active men, preparing the conditions for half the population of the world in Asia to be at risk of getting HIV infection. So the unintended negative consequences of what was probably done for benevolent reasons turned out to be a very great negative. And there are many other examples where Prohibition has encouraged more dangerous drugs to replace less dangerous drugs, such as when alcohol was prohibited in the United States in 1920. The first drug to disappear was beer, and as soon as Prohibition was repealed in 1933, beer came back straight away. So when beer disappeared, the people who wanted to drink alcohol in the United States had the choice of wine or spirits, which were much more lucrative to traffic. Another problem that we have to remember is here, which we don't have to worry about with the issue of same-sex sex, is the power of vested interests. Frederick Douglass was well-known in the United States, a well-known abolitionist, African-American abolitionist who fought for the abolition of slavery. And he said, power conceives nothing without a demand. It never did, and it never will. So don't think that drug reform is inevitable. If you want it, if we want it, we're going to have to fight for it. Now, what is it going to actually involve? The first thing it's going to involve, the first threshold step, is redefining this issue away from the notion that it is primarily a criminal justice issue and redefining it as primarily a health and social issue. Health and social, both parts, are very important. And once that threshold decision is made, then many other decisions follow automatically, including the absolutely primary need for policy to be based on evidence. Another thing that follows